Have you ever looked in the mirror and felt like your body is telling a story you don't recognize? A puffy face, unexplained bruises, or a heaviness in your heart that wasn't there before? As a senior, these changes can feel like the weight of time. But what if there's something more? I'm Dr. Emily Hart, an endocrinologist who's seen countless seniors reclaim their vitality by listening to their body's whispers. Today, I'm diving into the 12 silent signs of high cortisol, the stress hormone that can quietly reshape your health, stealing your strength, sleep, and spark. From moon face to emotional numbness, these signs aren't just aging, they're your body begging for attention. Stay with me until the end because I'm not just sharing what to look for. I'm giving you practical, heartfelt steps to lower cortisol naturally and protect the vibrant years you've earned. Don't miss this. It could be the key to feeling like yourself again. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 12 signs of high cortisol in seniors. 1. A puffy, rounded face, moon face. Have you noticed your face appearing unusually full, almost swollen, even though your overall weight hasn't changed significantly? This condition, often referred to as moon face, is a classic and highly recognizable symptom of elevated cortisol levels, the body's primary stress hormone. Moon face occurs when cortisol triggers a redistribution of fat to specific areas, particularly the cheeks, neck, and upper chest, creating a rounded, puffy appearance that can feel unfamiliar and distressing. For seniors, this change can be especially jarring, as it alters the face they've known for decades, sometimes leading to feelings of self-consciousness or loss of identity. It's not merely a cosmetic issue, it's a physical manifestation of an internal imbalance. Moon face is frequently associated with conditions like Cushing's syndrome, a disorder caused by prolonged high cortisol levels, or with long-term use of corticosteroid medications such as prednisone, which is commonly prescribed for chronic conditions like rheumatoid arthritis, chronic obstructive pulmonary disease, COPD, or autoimmune disorders. Unlike temporary facial puffiness caused by a salty meal, dehydration, or lack of sleep, moon face is persistent and disproportionate, often accompanied by other symptoms of cortisol excess. For seniors, this can also exacerbate feelings of fatigue or discomfort, as the added weight in the face and neck may contribute to a sense of heaviness. If you've noticed this change, it's worth discussing with a healthcare provider, as it could indicate an underlying hormonal issue or a side effect of medication that needs adjustment. 2. The telltale buffalo hump. One of the more distinctive signs of high cortisol is the development of a soft, fatty mound at the base of the neck or upper back, commonly known as a buffalo hump. This isn't just a small roll of fat or a result of poor posture. It's a specific accumulation of adipose tissue driven by cortisol's disruption of normal fat storage patterns. For seniors, this hump can feel like a heavy, unwelcome burden, both physically and emotionally. It may cause discomfort during everyday activities, such as turning the head, looking over the shoulder, or even lying down comfortably. In some cases, the hump can contribute to neck stiffness or pain, further impacting mobility and quality of life. The buffalo hump is a hallmark of chronic cortisol elevation, often linked to conditions like Cushing's syndrome or prolonged use of steroids for managing chronic illnesses. Unlike general weight gain, this fat deposit is localized and resistant to typical weight loss efforts, making it a frustrating and persistent symptom. For seniors, who may already be dealing with age-related changes in posture or muscle strength, the buffalo hump can exacerbate feelings of physical limitation. If you notice this symptom, it's a clear signal that your body is under cortisol's influence, and a medical evaluation is crucial to identify the root cause and explore treatment options. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Purple stretch marks that speak volumes. Stretch marks are often associated with rapid growth during adolescence or pregnancy, but when they appear as wide, purplish streaks across the abdomen, thighs, hips, or sides in adulthood, particularly in seniors, they can be a striking indicator of high cortisol levels. These aren't the faint, silvery lines that fade over time. Cortisol-related stretch marks are bold, vivid, and often deep red or purple, standing out starkly against the skin. They occur because cortisol weakens the skin's collagen and elastin, the proteins responsible for its strength and elasticity, causing it to tear under even minor stretching. For seniors, whose skin naturally thins with age, these stretch marks can feel like an unwelcome addition to already fragile skin. They may appear suddenly and spread across larger areas, creating a map of internal imbalance that's visible. Beyond their cosmetic impact, these marks can cause mild discomfort, such as itching or tenderness, and serve as a reminder that cortisol is affecting the body's structural integrity. If you notice these distinctive stretch marks, especially if they appear without significant weight gain or stretching, it's a sign to consult a healthcare professional to investigate potential causes like Cushing's syndrome or medication side effects. 4. Bruising that betrays fragile skin. Have you noticed that even the lightest touch, a gentle bump against a table, a soft grip during a hug, or simply brushing against a doorframe, leaves behind a bruise? This excessive bruising is a telltale sign of high cortisol levels, which can significantly weaken the skin and its underlying structures. Cortisol thins the skin by reducing the production of collagen, a critical protein that provides strength and resilience, while also making blood vessels more fragile. As a result, minor impacts that would typically go unnoticed cause blood to leak under the skin, forming bruises that appear like unwelcome, colorful blossoms. For seniors, this symptom can be particularly pronounced, as aging naturally reduces skin thickness and elasticity, making it more susceptible to damage. You may notice these bruises most often on the arms, legs, or hands, areas where the skin is already delicate and blood vessels are closer to the surface. These bruises may range from small, purple spots to larger, multicolored patches that take weeks to fade. Beyond the cosmetic concern, which can lead to self-consciousness or frustration, this fragility is a warning sign of cortisol's broader impact on your body. It may point to conditions like Cushing's syndrome or prolonged use of corticosteroid medications, such as prednisone or hydrocortisone, commonly prescribed for conditions like arthritis, autoimmune disorders, or chronic inflammatory diseases. If bruising occurs frequently or without a clear cause, it's a signal to consult a healthcare provider to assess cortisol levels and explore underlying issues, as this symptom reflects a body struggling under hormonal strain. 5. Central obesity that won't budge. Have you observed your waistline expanding, even though your arms and legs remain relatively thin or unchanged? This pattern, known as central obesity, is a hallmark of high cortisol levels and a significant red flag for hormonal imbalance. Unlike general weight gain, which tends to distribute fat more evenly across the body, cortisol-driven central obesity causes fat to accumulate specifically around the abdomen and internal organs, creating a stubborn, rounded belly that resists even the most dedicated efforts at diet and exercise. This visceral fat, which surrounds vital organs like the liver and pancreas, is not just a cosmetic issue, it's a serious health concern. For seniors, central obesity can be particularly troubling. It's not just about struggling to fit into favorite clothes or feeling frustrated by a changing body shape. This type of fat distribution significantly increases the risk of serious health conditions, including heart disease, type 2 diabetes, and metabolic syndrome. Cortisol promotes this fat storage by altering how the body processes glucose and fat, favoring abdominal accumulation over other areas. This can be exacerbated by age-related declines in metabolism and muscle mass, making weight management even more challenging. Conditions like Cushing's syndrome or long-term corticosteroid use are common culprits, but stress and poor sleep can also contribute to elevated cortisol levels. If you're noticing this disproportionate belly fat, it's critical to seek medical advice to evaluate cortisol levels and address potential underlying causes. This isn't just a wardrobe frustration. It's a health warning that demands attention to protect your long-term well-being. 6. Muscle weakness that steals strength. Tasks that once felt effortless, such as climbing a flight of stairs, now seem as daunting as summiting a rugged peak. Rising from a chair, lifting a grocery bag, or even walking across a room can become a laborious struggle, marked by a disheartening sense of diminished power. This isn't merely the inevitable toll of time, it's the insidious work of elevated cortisol levels, which accelerate the catabolic breakdown of muscle tissue. Cortisol, often dubbed the stress hormone, triggers the body to break down proteins in muscle fibers to fuel its stress response, gradually eroding muscle mass and strength. For seniors, this progressive weakening carries profound implications beyond physical limitations. The loss of muscle strength can significantly undermine independence, transforming routine daily activities, such as getting out of bed, bathing, or preparing a meal, into monumental challenges that require effort, planning, or even assistance. This erosion of autonomy can foster feelings of frustration, helplessness, or diminished self-worth, as the ability to navigate life with ease slips away. Unlike the natural muscle decline associated with aging, cortisol-driven muscle loss is a direct consequence of chronic stress, silently robbing the body of its resilience and vitality. Over time, this can lead to a vicious cycle. Reduced strength limits physical activity, which further accelerates muscle loss, making it critical to address the root cause of elevated cortisol to preserve both physical function and quality of life. 7. Sleepless nights that drain your spirit. In a healthy body, cortisol follows a natural circadian rhythm, peaking in the morning to energize you for the day and dipping at night to signal the body to relax and drift into deep, restorative sleep. However, when cortisol levels remain stubbornly elevated due to chronic stress, this delicate balance is disrupted, leaving you trapped in a cycle of sleeplessness. You may find yourself tossing and turning, unable to quiet your racing mind, or waking repeatedly throughout the night, only to rise feeling as though you haven't slept at all. For seniors, the consequences of poor sleep extend far beyond physical fatigue. Chronic sleep deprivation compounds exhaustion, making even simple tasks feel overwhelming. It clouds cognitive function, impairing memory, focus, and decision-making, which can make daily life feel like navigating through a fog. Emotionally, the impact is equally profound. Sleeplessness can dim the joy of waking to a new day, sap enthusiasm for hobbies or social interactions, and even contribute to feelings of irritability or low mood. For those in their later years, restful sleep is not just a luxury. It's a cornerstone of mental and physical health, essential for maintaining vitality and resilience. If insomnia has become a persistent nightly companion, leaving you drained and disconnected, high cortisol levels may be the hidden culprit, quietly sabotaging your ability to rest and recharge. Addressing this imbalance is crucial to restoring the restorative sleep needed to thrive. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 8. Thinning hair that whispers change. Your once vibrant, full head of hair, perhaps a source of pride or a defining feature of your appearance, may begin to thin, shed excessively, or lose its luster, leaving your scalp noticeably sparser and your reflection unfamiliar. This distressing change is often linked to elevated cortisol, which disrupts the natural hair growth cycle. Cortisol pushes hair follicles into the telogen, resting, phase prematurely, halting growth and triggering excessive shedding, while also impairing the regeneration of new hair. For seniors, this thinning can feel like more than just a cosmetic concern. It can strike at the heart of personal identity. Hair, often tied to self-expression and confidence, carries emotional weight, and its loss can evoke a sense of grief or disconnection from the person you once were. Seeing a stranger's reflection in the mirror, with noticeably thinner or lackluster hair, can serve as a daily reminder of the body's struggle against chronic stress. This isn't merely a matter of vanity. It's a visible manifestation of internal imbalance, signaling that cortisol is taking a toll on your body's resilience. For many seniors, this change can also exacerbate feelings of aging or vulnerability, making it harder to maintain a positive self-image. Recognizing thinning hair as a potential symptom of elevated cortisol underscores the importance of addressing stress to restore not only physical health but also emotional well-being and a sense of self. 9. Acne and oily skin that surprises. The sudden emergence of adult acne or excessively oily skin can be a bewildering and unwelcome surprise, particularly for seniors who long ago left behind the skin struggles of youth. These dermatological changes are often driven by elevated cortisol levels, which overstimulate the skin's sebaceous glands, leading to increased oil production. This excess oil clogs pores, creating a breeding ground for inflammation and pimples, while also giving the skin an uncharacteristically greasy appearance. For those in their golden years, this resurgence of acne can feel like an unfair twist, disrupting the expectation of clear, low-maintenance skin in later life. Beyond the physical discomfort of breakouts, redness, irritation, or even pain, these skin changes can carry a significant emotional toll. For seniors, who may already be navigating the challenges of aging, dealing with acne or oily skin can erode confidence and self-esteem, making social interactions or even looking in the mirror feel disheartening. These skin issues are not just a surface-level inconvenience. They are a visible sign of internal stress, reflecting the body's struggle to maintain balance under the weight of chronic cortisol elevation. Addressing this underlying cause is essential not only for restoring clear, healthy skin but also for reclaiming the comfort and confidence that come with feeling at home in one's own body. 10. Blood pressure that climbs quietly. Chronic elevation of cortisol, a stress hormone produced by the adrenal glands, can significantly disrupt cardiovascular health in ways that are often subtle and difficult to detect without vigilant monitoring. Cortisol exerts its effects by causing vasoconstriction, a process where blood vessels narrow, increasing resistance to blood flow and elevating blood pressure. Additionally, cortisol promotes sodium retention in the kidneys, which leads to fluid retention and further drives up blood pressure. For seniors, this gradual increase in blood pressure can be particularly concerning, as it may exacerbate pre-existing conditions such as hypertension, coronary artery disease, or heart failure, or even precipitate new cardiovascular problems in those previously unaffected. The insidious nature of cortisol-driven hypertension lies in its ability to mimic or overlap with other age-related health issues, making it challenging to pinpoint without targeted investigation. Seniors might notice symptoms such as persistent headaches, dizziness, blurred vision, or shortness of breath, but these are often dismissed as normal signs of aging or attributed to other conditions. For those already managing blood pressure with medications, lifestyle changes, or dietary adjustments, a troubling trend of consistently higher readings, despite treatment adherence, may suggest cortisol as a hidden culprit. For example, a senior might find their blood pressure readings creeping from 130/80 mmHg to 150/90 mmHg over months, even with no apparent changes in diet or activity. Left unchecked, this can increase the risk of serious complications like stroke, heart attack, or kidney damage. Addressing this issue requires a proactive approach, including regular blood pressure monitoring, stress management techniques, and possibly testing cortisol levels through blood, saliva, or urine tests. For seniors and their healthcare providers, recognizing cortisol's role in blood pressure regulation can lead to more tailored interventions, such as adjusting medications, incorporating stress-reducing practices like mindfulness or yoga, or exploring underlying causes of cortisol elevation, such as chronic stress or adrenal dysfunction. Early detection and management are critical to preventing long-term cardiovascular damage and improving quality of life. 11. Frequent infections or slow-healing wounds. Elevated cortisol levels can profoundly weaken the body's immune system and impair its ability to repair itself, leading to a cascade of health challenges that are particularly impactful for seniors. Cortisol suppresses immune function by reducing the production and activity of key immune cells, such as T cells and macrophages, which are essential for fighting off pathogens. This leaves the body more susceptible to infections, from common colds and flu to more serious conditions like pneumonia or urinary tract infections. For older adults, who may already have a naturally declining immune system due to aging, a phenomenon known as immunosenescence, this cortisol-driven suppression can result in frequent illnesses, prolonged recovery times, and a pervasive sense of diminished resilience. Additionally, cortisol slows the body's natural healing processes by inhibiting the production of collagen and other proteins necessary for tissue repair. As a result, minor injuries, such as cuts, scrapes, bruises, or even surgical wounds, may take significantly longer to heal, sometimes lingering for weeks or months. For example, a small cut on the hand that would typically heal in a week for a younger person might remain open and prone to infection for a senior with high cortisol levels. This delayed healing can be frustrating and concerning, increasing the risk of complications like infections or chronic wounds, which are particularly dangerous for seniors with comorbidities such as diabetes or poor circulation. Seniors might notice they're catching every cold going around, battling recurrent sinus infections, or dealing with skin abrasions that seem to persist indefinitely. These symptoms are often brushed off as just part of getting older, but they may indicate a cortisol-related imbalance that warrants attention. The practical implications are significant. Frequent illnesses can lead to more doctor visits, increased medical costs, and a reduced sense of vitality, while slow healing wounds can limit mobility and independence. Caregivers and healthcare providers should consider cortisol testing if these patterns emerge, alongside strategies to bolster immune health, such as optimizing nutrition, e.g., ensuring adequate vitamin C and zinc, managing stress, and addressing any underlying conditions contributing to elevated cortisol. By tackling this issue, seniors can restore their body's ability to fend off infections and heal efficiently, improving overall well-being. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 12. Emotional tides of anxiety or numbness. Chronic elevation of cortisol can profoundly disrupt emotional well-being by altering the delicate balance of neurotransmitters in the brain, such as serotonin, dopamine, and GABA, which are critical for regulating mood, motivation, and emotional stability. This disruption can manifest in a variety of ways, including persistent anxiety, heightened irritability, or a troubling sense of emotional detachment or numbness. For seniors, these emotional changes can be particularly distressing, as they may feel like a loss of the vibrancy and joy that once defined their lives. For example, a senior might find themselves snapping at loved ones over minor issues, feeling inexplicably anxious about routine tasks like grocery shopping, or experiencing a pervasive sense of apathy, where activities that once brought pleasure, like hobbies, social gatherings, or even time with grandchildren, feel lackluster or unengaging. These emotional shifts are often mistaken for normal aging, stress from life changes, such as retirement or loss of a loved one, or even early signs of cognitive decline or depression. However, cortisol's impact on the brain's limbic system, which governs emotions, can create a distinct pattern of mood instability that sets it apart from other causes. For instance, a senior might describe feeling on edge, despite a relatively stable life, or report a sense of emotional flatness that makes it hard to connect with others. These symptoms can erode quality of life, strain relationships, and lead to social withdrawal, which further exacerbates feelings of isolation and emotional distress. The physiological mechanisms behind these changes are complex. Cortisol overproduction can overstimulate the amygdala, the brain's fear center, leading to heightened anxiety, while simultaneously dampening activity in the prefrontal cortex, which regulates rational thinking and emotional regulation. Over time, this imbalance can create a vicious cycle where emotional distress further elevates cortisol, perpetuating the problem. For seniors, this can feel like a loss of their emotional spark, making it critical to recognize that these changes are not an inevitable part of aging but a signal that the brain and body need support. Addressing cortisol-related mood disturbances requires a multifaceted approach. Seniors and their caregivers should consider consulting a healthcare provider to assess cortisol levels and explore potential causes, such as chronic stress, sleep disturbances, or adrenal issues. Interventions might include stress reduction techniques, e.g., meditation, deep breathing exercises, or gentle physical activity, counseling to address emotional triggers, or, in some cases, medications to stabilize mood. Lifestyle changes, such as improving sleep hygiene, maintaining a balanced diet rich in omega-3 fatty acids and antioxidants, and fostering social connections, can also help restore emotional balance. By recognizing cortisol's role in these emotional tides, seniors can take steps to reclaim their emotional vitality and rediscover the richness of life. Unraveling the causes of elevated cortisol levels. Elevated cortisol levels are more than just a byproduct of stress. They stem from an intricate web of medical, physiological, and lifestyle factors that can profoundly affect health, particularly in older adults. Cortisol, often dubbed the stress hormone, is produced by the adrenal glands and plays a critical role in regulating metabolism, immune responses, and stress adaptation. However, when levels remain consistently high, they can contribute to a cascade of health issues, including fatigue, weight gain, mood disturbances, and weakened immunity. For seniors, whose bodies may be less equipped to handle prolonged physiological stress, understanding and addressing high cortisol is paramount. Below, we explore the primary drivers of elevated cortisol and their implications, with a special focus on older adults. Key contributors to high cortisol. Cushing's syndrome, a rare but serious medical condition. Cushing's syndrome is an uncommon yet severe disorder caused by excessive cortisol production, often triggered by a tumor in the pituitary gland, Cushing's disease, adrenal glands, or, in rare cases, ectopic tumors elsewhere in the body. This condition floods the body with cortisol, leading to distinctive symptoms such as a rounded moon face, a fatty hump between the shoulders, purple stretch marks, striae, and fragile skin that bruises easily. For seniors, these symptoms can be mistaken for age-related changes, delaying diagnosis. Cushing's syndrome requires prompt medical evaluation through blood tests, imaging, like MRI or CT scans, and sometimes specialized tests like the dexamethasone suppression test. Treatment often involves surgery to remove the tumor, radiation, or medications to control cortisol production. Left untreated, Cushing's can lead to serious complications, including heart disease, osteoporosis, and cognitive decline. Steroid medications, a common culprit. Long-term use of corticosteroid medications, such as prednisone or hydrocortisone, is a frequent cause of elevated cortisol-like effects. These drugs, often prescribed for chronic conditions like rheumatoid arthritis, lupus, chronic obstructive pulmonary disease, COPD, or other inflammatory disorders, mimic cortisol's actions in the body. While effective for managing inflammation, prolonged use can lead to side effects resembling Cushing's syndrome, including weight gain, muscle weakness, and thinning bones, issues that are particularly concerning for seniors, who are already at higher risk for osteoporosis and frailty. If you're taking steroids, it's critical to work closely with your healthcare provider to monitor doses and explore alternative treatments when possible to minimize cortisol-related side effects. Chronic stress, a relentless trigger. Chronic stress, whether from financial worries, caregiving responsibilities, health concerns, or social isolation, keeps the body's stress response in overdrive, leading to persistently elevated cortisol levels. For seniors, these stressors can be compounded by life transitions, such as retirement or the loss of loved ones, which may amplify feelings of anxiety or uncertainty. Over time, sustained high cortisol can weaken the immune system, increase blood pressure, disrupt sleep, and contribute to conditions like insulin resistance or heart disease. Unlike acute stress, which triggers short-term cortisol spikes, chronic stress creates a cumulative burden that can accelerate age-related decline, making stress management a critical priority for older adults. Pseudo-Cushing's, mimicking the real thing. Certain medical conditions can produce symptoms that resemble Cushing's syndrome but are not caused by tumors or excessive cortisol production. Known as pseudo-Cushing's, these conditions include depression, obesity, uncontrolled diabetes, or excessive alcohol consumption. For example, depression can elevate cortisol through dysregulation of the hypothalamic-pituitary-adrenal (HPA) axis, while obesity and diabetes can create a feedback loop that sustains high cortisol levels. The good news is that pseudo-Cushing's often resolves when the underlying condition is addressed, whether through mental health treatment, weight management, or better blood sugar control. For seniors, distinguishing between true Cushing's and pseudo-Cushing's is essential, as the treatment approaches differ significantly. If you are still watching this video and finding these lessons useful, please comment number 4 below to let me know that you are still watching this video with me. Thank you for your valuable time. Clarifying the role of stress in cortisol elevation. While everyday stress alone is unlikely to cause dramatic physical symptoms like moon face, purple stretch marks, or severe weight gain, which are more indicative of medical conditions like Cushing's or steroid overuse, it can still have a profound impact on health. Chronic stress subtly erodes resilience, particularly in seniors, whose bodies may struggle to recover from prolonged cortisol elevation. Over time, this can manifest as fatigue, irritability, poor sleep, and increased susceptibility to illness. Recognizing the difference between stress-related cortisol spikes and medical causes is crucial for determining the right course of action. Empowering seniors. Practical steps to lower cortisol naturally. High cortisol doesn't have to define your health. It's a signal to take proactive steps to restore balance and vitality. For seniors, managing cortisol involves a holistic approach that respects the body's unique needs and honors its lifelong journey. Here are detailed, actionable strategies to naturally reduce cortisol levels and promote well-being. Make sleep a sacred priority. Quality sleep is one of the most powerful tools for regulating cortisol. Aim for 7 to 9 hours of restorative sleep each night to allow your body to repair and reset. Create a calming bedtime routine to signal to your brain that it's time to unwind. Dim the lights, avoid screens at least an hour before bed to reduce blue light exposure, and consider sipping a soothing herbal tea like chamomile or valerian root. Maintain a consistent sleep schedule, even on weekends, to stabilize your body's circadian rhythm. For seniors, who may experience age-related sleep challenges like insomnia or lighter sleep cycles, a comfortable sleep environment, cool, dark, and quiet, can make a significant difference. If sleep issues persist, consult a healthcare provider to rule out conditions like sleep apnea or restless leg syndrome, which can further elevate cortisol. Embrace mental rest and stress reduction. Chronic stress accumulates with age, but intentional practices can counteract its effects. Incorporate mindfulness techniques such as deep breathing exercises, e.g., diaphragmatic breathing or the 4-7-8 method, which activate the parasympathetic nervous system and lower cortisol. Gentle yoga or tai chi, tailored to your mobility level, can combine physical movement with mental relaxation, offering dual benefits for body and mind. A daily walk in nature, whether in a park, garden, or quiet neighborhood, can also serve as a meditative practice, reducing stress hormones by fostering a sense of calm and connection. For seniors, these activities aren't just self-care. They're a way to reclaim mental clarity and emotional resilience in the face of life's challenges. Nourish your body with intention. A balanced diet is a cornerstone of cortisol regulation, as it helps stabilize blood sugar levels, which cortisol can disrupt. Focus on whole, nutrient-dense foods, lean proteins, like chicken, fish, or legumes, fiber-rich vegetables, such as leafy greens, broccoli, or carrots, and healthy fats, found in avocados, nuts, or olive oil. These nutrients provide steady energy and prevent blood sugar spikes that can trigger cortisol release. Limit refined sugars and processed carbohydrates, which can cause rapid blood sugar fluctuations and exacerbate stress responses. For seniors, who may face challenges like reduced appetite or digestive changes, small, frequent meals can be easier to manage. Stay hydrated, as dehydration can subtly increase cortisol levels. Consulting a dietitian can help tailor a nutrition plan to your specific needs, especially if you're managing conditions like diabetes or heart disease. Seek medical guidance when needed. If you suspect your cortisol levels are elevated due to a medical condition like Cushing's syndrome or steroid use, consult a healthcare provider promptly. Blood tests, urine tests, or imaging can help identify the root cause. For stress-related cortisol elevation, consider working with a therapist or counselor to address underlying emotional triggers. Seniors may also benefit from regular checkups to monitor cortisol-related complications, such as bone density loss or cardiovascular risks, ensuring a comprehensive approach to health. As we wrap up, I want to take a moment to thank you for joining me on this journey to understand the silent ways high cortisol can affect your life as a senior. Your body is speaking, through a puffy face, restless nights, or a heart that feels heavier than it should, and now you have the tools to listen and act with compassion. High cortisol isn't just a medical term. It's a call to nurture the incredible life you've built. So, what have you learned today? Maybe it's the importance of prioritizing sleep, the power of a gentle walk, or the courage to talk to your doctor about those unexplained changes. I'd love to hear from you. What's one thing you've learned from this video that you'll bring into your life to practice? Please share it in the comments below. Your story could inspire someone else. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more heartfelt insights to keep you thriving in your golden years. Stay vibrant, and I'll see you in the next one.